Hello and welcome to the maternity unit at Our Lady of Lourdes Hospital, Drogheda. My name is Gráinne Millen and I am the Director of Midwifery here in Our Lady of Lourdes Hospital and Louth County Hospital, Dundalk. I want to start by saying congratulations on your pregnancy and thank you for choosing Our Lady of Lourdes Hospital to birth your baby. We have an absolutely fantastic team of staff working here to support you and your partner through your pregnancy, during labour and birth, and also after your baby is born. In the following videos, you will get to meet some of the wonderful members of our midwifery and nursing teams. These videos are an opportunity for you to view a number of the supports and services we provide here. I really hope you find them helpful. I would like to end by offering you the very best wishes for a happy and healthy pregnancy. Thank you for listening.
Hi, and welcome to the Antenatal Clinic in Our Lady of Lourdes Hospital. Congratulations on your pregnancy. Let me walk you through what to expect at your book and visit here with us. When you come into the hospital, follow the signs or ask at reception for the Antenatal Clinic. Check in with the secretaries. The secretary will check your details, for example, GP, your address, contact numbers. If any of these details change during your pregnancy, please let us know. Then proceed down into the clinic. Here you will meet the healthcare attendant. They will check your blood pressure, height and weight and test your urine. Please have a sample ready. Urine pots are available here or in the bathroom. Please have a urine sample for each appointment and you may take a few pots home. Please take a seat and wait to be called. After your blood pressure and urine are checked, you will wait to be seen by the doctor or midwife. The midwife will bring you into a room and go through your medical history, and some of this may have been done beforehand over the phone. After meeting the midwife, you will be brought over to phlebotomy to have your bloods taken. We advise you to book your appointment for your bloods via Swift Queue in advance of your booking visit. After this, you will then be shown where the scan department is, where there's a secretary for you to check in with. After the scan, you will return to the antenatal clinic where the midwife will check your scan and advise you of your follow-up appointment. You will be given handheld cream notes to take home. This is a cream chart, which you will share between your GP and the hospital, so make sure you always bring your cream chart with you to the visits. The other chart, which is the orange chart, remains in the hospital. Looking forward to welcoming you here with us and being part of your pregnancy.
Hi, my name is Fiona Maloney and I'm the manager of the Midwifery-led unit. Congratulations on your pregnancy. The Midwifery-led unit offers both antenatal, labour and postnatal care for women who are having a low-risk pregnancy. There is a team of midwives and we aim to ensure that our care is provided in partnership with the women and their partners. When you book into Our Lady of Lourdes Hospital, you will initially be seen in the antenatal clinic. The midwives there will take a detailed history and offer you MLU care if you are deemed low risk. The MLU has an antenatal clinic in both Drogheda and Dundalk. Your first appointment in the MLU is at approximately 26 weeks. Your care is then shared between the GP and the MLU. At each appointment, you will have a blood pressure checked, a urine check, and your abdomen will be palpated and your baby's heartbeat will be listened to. Your care is individualised and the midwives are there to offer you support and advice on a wide range of issues. Sometimes situations may arise in your pregnancy and we work closely with the advanced midwife practitioner or your consultant to ensure you receive the most appropriate care. As every woman is an individual, the facilities within the MLU are designed specifically with this in mind. We have 2 birthing rooms which are equipped with birthing aids designed uniquely for support to facilitate the freedom of choice, such as a birth pool and birthing balls. You are encouraged to personalise the birthing room to make it a safe and relaxing environment. The midwives will take care of you throughout your labour and birth. After your baby is born, we take care of both you and your baby in the hospital and then in your home. If you choose to, you can opt for a 6-hour discharge. We will come to visit you in a number of times in your home, where you will do a full postnatal check of you and your baby and assist with any support needed. After 7 days, your care is then transferred over to the public health nurse. It is our hope that attending the MLU will be a fulfilling and memorable experience.
Hello, my name is Emer McCormick. I am the Advanced Midwife Practitioner in Supported Care Pathway in the Maternity Unit in Our Lady of Lourdes Hospital. So Supported Care Pathway is for women with low risk, uncomplicated pregnancies. In this pathway, your care will be led and provided by midwives. Here in the Maternity Unit in Our Lady of Lourdes in Drogheda, you may choose to birth in our midwifery-led unit. Part of my role is to provide care and support to women on this pathway that may require temporary transfer during pregnancy. Temporary transfer from midwifery-led care may be necessary due to a situation arising with you or your baby where closer monitoring is recommended. I will continue your routine antenatal care during your transfer and investigate and manage specific situations in partnership with you and a consultant obstetrician if required. I also provide care for women attending our birth after caesarean services alongside a consultant obstetrician. Women who have had one previous caesarean section and have a low risk uncomplicated pregnancy will be offered this service. It is our aim that you will receive continuity of care from myself, the Advanced Midwife Practitioner, and will feel informed and empowered to make the right choices for you and your baby during this birth after caesarean. In the Maternity Unit, Our Lady of Lourdes Hospital, we aim to provide you with the right care, with the right healthcare professional and in the right place at all times during your pregnancy and beyond. So, congratulations on your pregnancy. I do look forward to meeting you and sharing this journey with you.
Hi there, my name is Sarah O'Brien and I am the Manager of Maternal Health and Wellbeing. Congratulations on your pregnancy. My role is to support you during your pregnancy and help you to create a healthier lifestyle for you and your family through antenatal education, health promotion and lifestyle changes. Pregnancy is an ideal time to try and adopt a healthier lifestyle by looking at your diet, physical activity and quitting habits that can be harmful to your baby, such as smoking and vaping. These changes can be a huge benefit to you and your baby, and we encourage you to continue with them after pregnancy. I run the antenatal classes in the hospital with the support of the MLU midwives. Our classes are for all expected parents attending Our Lady of Lourdes Hospital. You are welcome to attend these classes for free, whether this is your first pregnancy or if you've had a baby before. Most of you will meet me at some point during your pregnancy at the different classes that we offer. Currently, we have an early pregnancy class that we recommend attending someone who are between 12 to 20 weeks. We have a labour and birth class between 32 and 36 weeks, a postnatal recovery and baby care class between 32 and 36 weeks, and also our infant feeding team run a breastfeeding class. Please email me at lourdespregnancyclass@hse.ie to find out more information about the classes and upcoming dates. I look forward to meeting you during your pregnancy at some point.
Hi, my name is Sarah and I am the CMM2 of the Teenage Pregnancy Service. My role is to provide support and help prepare young parents to transition into parenthood. I work alongside our obstetricians and midwives to ensure that you have the support and education throughout your pregnancy, birth and postnatal period. At your first antenatal booking appointment, you will meet with me for the first time. We will spend time getting to know one another while I'm taking your history. We will also discuss some information regarding diet, exercise, smoking and your social setting. A plan of care will then be created for your pregnancy based on the information I gather from you. I work closely with our social work department here in Our Lady of Lourdes Hospital. You can get extra support from them and information on a variety of topics, including housing, financial benefits and entitlements. All teenage pregnancies are referred to the social work department at the booking appointment. They will link in with you to discuss any areas in which they can help provide extra support to you. Accessing antenatal care during your pregnancy is vital to ensure that your pregnancy is progressing as it should. Throughout your pregnancy, I try to meet with you at all of your antenatal appointments. This provides me with the opportunity to monitor your pregnancy's progression. It is at these appointments that we may notice deviations from normal that may need further investigation, such as the growth of your baby, blood pressure, iron levels, baby movements, etc. This is also a great opportunity for you to ask any questions that you may have in relation to your pregnancy, labour, birth and postnatal period. Should you have any issues with attending for these appointments, please let me know ahead of time so we can reschedule to the next available date. I provide a teenage antenatal class once per month. This class is to prepare you for labour and birth. It is a group session where you may meet other mums and dads in the same situation as you. Should you feel uncomfortable in this setting, we can arrange one-to-one classes at a time and date that will suit you. If you wish to book either the group class or an individual class, please just speak to me at your next visit, or alternatively, you can contact me on 087 451 7859, Monday to Thursday from 8 AM until 4:30 PM or until 2 PM on a Friday. Should you have any questions or concerns in relation to your pregnancy, please don't hesitate to contact me either by text or phone call. I look forward to meeting with you all.
Hi, my name is Karen and I'm a midwife in the early transfer home. The ETH gives you and your baby an option of taking an early discharge home from hospital. Once you and your baby are well and live within 20 kilometres from the hospital, you may be suitable to go home early. The ETH midwives will then visit you at home for the first week. We provide your postnatal care along with breastfeeding support in the comfort of your own home. You don't have to book for this service. The midwives on the ward will assess to see if you and your baby are suitable to take an early transfer home. Following a normal vaginal birth, you can go home after 6 hours, 12 hours after an instrumental delivery and 48 hours after a caesarean section. Women who've availed of the ETH have reported a quicker recovery in the comfort of their own home with midwifery support. The advantage of this service is that you have the ongoing support from your midwife for the first week after giving birth. The ETH midwives are certified in the examination of the newborn. This qualification enables us to carry out your baby's head-to-toe examination prior to discharge home from hospital. During these visits, we also provide you with advice and support in caring for and feeding your baby. If there are any problems identified by the ETH midwives, we can arrange to have you seen in the hospital by the obstetric team or your baby by the paediatric team. We provide phone calls to you on the days in between your visits to ensure that you and baby are doing well. At one of your home visits, the ETH midwife will carry out your baby's newborn screening test, more commonly known as the blood spot test or heel prick test. The ETH midwives will monitor your baby's weight at home and if deemed necessary, carry out jaundice tests on your baby, reducing your need to return to hospital for such testing. The ETH midwives are experienced in breastfeeding support and liaise closely with the lactation team within the hospital. After 7 days, we transfer you and your baby to the care of your own GP and your local public health nurse for your ongoing community care.
My name is Anya McCardle and I am the bereavement support midwife here in Our Lady of Lourdes Hospital. In the vast majority of cases, pregnancy is a happy and positive experience. However, in some rare instances, women and their families may experience pregnancy loss. My role as bereavement support midwife is to provide practical and emotional support to women and their families who are sadly experiencing pregnancy loss. I work alongside the doctors, staff midwives, medical social workers and the chaplaincy team to ensure any family who requires bereavement support receives good quality care which is compassionate and sensitive to their individual needs.
my name's Lynette McGoey and I'm the perinatal mental health support midwife here at Our Lady of Lourdes Hospital, Drogheda. Pregnancy is a time of great change, physical, emotional and psychological, so it's important to be mindful of your emotional health and well-being during this time. There are many different types of mental illness and the severity can vary. Depression and anxiety are the most common mental health problems in pregnancy, affecting about 10 to 15 out of every 100 pregnant women, and it can happen to any one of us. It's just as important to diagnose and treat mental health problems as it is for physical health problems in pregnancy. You can still be a great mother even if you're experiencing perinatal mental illness. This is nothing to feel ashamed about. Antenatal mental illness, if left untreated, can result in postnatal illness, so it's important to seek help while you're pregnant. As a perinatal mental health support midwife, I work in collaboration with your obstetrician, midwives, GP, community mental health teams and public health nurse in order to provide you with the best individualised person-centred care to meet your specific needs. Your GP or community mental health team can discuss medication and treatment options, and you can take most mental health medications while you're pregnant and breastfeeding. During your booking appointment, the midwife will give you the opportunity to discuss your mental health and offer you a referral if necessary. Should you decline a referral, you will receive contact details should you change your mind. I can speak to you by phone or in the clinic in confidence and help you with any queries you may have. And I can provide you with support in both the antenatal and postnatal periods.
Hello, my name is Sinead Thompson and I'm a community midwife at the National Maternity Hospital. I designed and created Labour Hopscotch in 2015 in response to an increase in the epidural rates and also in medical interventions during labour and birth. The principle of Labour Hopscotch is to encourage optimal fetal positioning. This means having your baby's head in the optimum position, lined up so it can descend into the pelvis in the optimum position for labour. When this happens, it triggers the spontaneous onset of labour. When women go into spontaneous labour, it's less likely that they'll need induction, and that means that there'll hopefully be less intervention in their births. The Labour Hopscotch framework aims to support and promote natural and active labour. It is encouraged for all women, regardless of the care pathway that they choose for their birth, but encourages more natural methods of pain relief where possible, for as long as possible in labour. Using the idea of the game hopscotch we all played years ago, each of the steps can be undertaken to remain active during labour. The process can start at home, beginning at the bottom of the hopscotch board when you're more active and mobile. The bottom square of the Labour Hopscotch is called the mobilised square and it aims at promoting optimal fetal position. There are 4 activities associated with this step, and it's important that these 4 positions are practiced throughout the antenatal period in preparation for your labour. Your midwife will explain the positions to you during your pregnancy. Our research findings, which we published in 2019 in our research study, showed that women who practiced Labour Hopscotch had reduced epidural rates, reduced the caesarean section rates, increased spontaneous onset of labour and vaginal deliveries, and most of all, there was an increase in birth satisfaction rates. Having a positive birthing experience makes a smoother transition to parenthood.
So I want to talk a little bit about perineal massage. A perineal massage is something that you can look up yourself on the internet, but ideally from 32-34 weeks gestation, either using the warm water in your bath or using a gentle lubricant such as coconut oil or olive oil, is to use your thumb and first finger. Your perineum is situated between your vagina and your back passage. So gentle pressure between in the perineal body helps to improve the circulation of the perineum, helping it to stretch and to thin during the labour process and helping to minimise perineal trauma. Although you may require to have suturing done post the birth of your baby, the healing process, even with that perineal suturing, can be improved by the utilisation of perineal massage in the antenatal period. So I'm going to start and talk a little bit about optimal fetal positioning. So this is a fancy term really for having your baby into the ideal position for labour and birth. So depending on where you're at in your pregnancy, usually around the 33-34 week mark, we're expecting your baby to move into a head first position. Certainly by 37 weeks, the ideal is that your baby will be in a head down position and ready for engagement for labour and birth. Talk a little bit about the fact that at 30 weeks, your baby may be in a breech position, that is bum first, not head first, and therefore ideally your baby should turn by 37 weeks. If that doesn't happen, don't panic. What we'll first and foremost do is organise a scan, organise a meeting with your consultant, and a decision will be made then regarding is there a way of getting your baby into an ideal head first position for labour and birth. So optimal fetal positioning is where the baby is already in a head down position, head first position, but is lying with the back of its head, the occiput, facing towards your back or your low back. Okay, you'll often hear this as described as back-to-back position. Okay, we know that coming up to delivery, up to 50% of women, their babies will be in an OP, occipital posterior, on either their left or their right side. And we know that during the labour process itself, most babies will turn so that ultimately they're born facing down as opposed to staying in an OP position where they're born facing upwards. So what can you do to improve your baby's position? First of all, if you're not experiencing backache or discomfort, once you're fit and active and healthy, you don't need to change your position to too much of a degree. What you can do, however, if you're feeling back pain and discomfort and it's associated with an OP position, what you can do is adapt forward facing position. If you have an active ball, fit ball in your house, you can utilise this as an aid to get your baby into an ideal position. What this achieves is a gentle, natural tilt of your pelvis, encouraging your baby to move from an OP to either occipital lateral or occipital anterior position on either side. This will ease your back discomfort and leaving your baby in a better position as you approach your due date. Another thing you can do is when you're sitting, either commuting for work, in work, or at home at night, to support your lower back, to put a small cushion in at the small of your back. This straightens the lower part of your back, also encouraging your baby to move that slight move forward that will ease discomfort on your lower back. Also, to improve your baby's position If you don't have a fit ball, you can use a straighter backed chair in your house rather than sitting on the sofa, or if you are sitting on a sofa or a more softer chair, to put that cushion in at the small of your back to reduce the curve at the lower back and encourage your baby into an ideal position. Another thing you can do to improve an OP position is to utilise a door in your house. Once the door handles are sufficiently well applied to the door, to put your feet flat on either side of the door, holding the door handles, and move down into a squatting position. Hold for a couple of seconds and then move backwards. What that is a gentle pelvic lunge and encourages the baby into an ideal position. Another thing you can do as your pregnancy advances, if you have stairs in your house, using the stairs and the banister in your house, whenever you need to go up and down those stairs, to move up and down sideways. Again, that causes a gentle rocking in your pelvis and encourages your baby into an ideal position. So with natural methods of induction, again, it's important to keep fit and active in pregnancy, just as your body is designed to become pregnant and carry your baby to term. There's every reason to believe that it will naturally progress into labour and birth. But these are just hints that may just help that situation of labour to occur. So we would encourage you to utilise post 37 weeks raspberry leaf tea in a tablet or a tea leaf form, which you can get in reputable supermarkets or health food stores. You can also consult with a suitably qualified homeopath, because there is homeopathic remedies that can assist in the onset of labour. So please, if you decide to utilise homeopathic remedies, do speak with a qualified homeopath. Other alternative methods that can assist in the onset of labour is speaking with a reflexologist or an acupuncturist and deciding on a session with either of these alternative therapists. We know that different disorders, minor disorders of pregnancy, such as nausea, vomiting, hemorrhoids, they can all so be remedied by the use of alternative therapy. So it's definitely something worth considering if you go to somebody who is appropriately qualified. Other methods of induction are consider sexual intercourse. Once your waters haven't broken, it's quite safe in the latter stages of pregnancy to utilise sexual intercourse as a way to induce your labour. Old wives' tales, stroke remedies with castor oil or hot baths haven't been proven to be effective and will possibly maybe cause gastric upset, so we wouldn't recommend those. Things we can also recommend here in MLU, or indeed if you're attending the consultant-led clinic, is if you get beyond your due date, we'll give you the opportunity to have a vaginal examination with a view to performing a membrane sweep. So what's a membrane sweep? Well, your cervix, the neck of your uterus, sits tucked in right inside your vagina, almost pointing towards your back passage. And it does this to protect your baby against ascending infection during the course of your labour. As you move beyond the 37-week mark, your baby moves down further into the pelvis, beginning to put pressure on the neck of the womb, encouraging it to move forward, begin to thin long before it begins to open. And this is a process known as effacement. And during that process of effacement, you will begin to lose your mucus plug, which is known as ischial. If we were to examine you post-term, we would be looking to see where the neck of the womb is positioned. Is it still thick? Is it beginning to thin? Is it partly opened? And if it's partly opened, we will put our gloved finger into the neck of the womb, and with a sweeping motion around the back of around the bag of waters, we're not looking to break them, but that sweeping motion can be sufficient to get that prostaglandin release, which, as I've just mentioned, will hopefully cause a release of oxytocin and stimulate the onset of labour. Now, we can't be guaranteed that it will work. We know that it can work for up to 1 in 8 women. In my experience, you might have 8 women who will do very well from a sweep, and maybe the next 8 who may need to have a second sweep. What we would do is a term plus 4 or 5 would normally offer you a sweep, and then if we're unable to do it, we'll come back and 2 or 3 days later to offer you a repeat opportunity to have a sweep. If you don't wish to have a sweep at term plus 4 or 5, that's perfectly okay. What we'll arrange for you to do is come back at term plus 10, to have an examination at that point, to have a sweep if it's possible, and then we will proceed to book you for medical induction, whereupon you will be admitted to the antenatal ward on the morning of term plus 13, which my colleague on labour ward will talk to you a little bit about in a little while. So that's methods of induction.